All right, welcome to This Explainer. Today, we are unpacking a massive paradigm shift in how we understand human health. We're talking about the mortality dividend. For the longest time, we've kind of just thought of emotional well-being as a nice to have, right? Like a happy side effect of already being healthy. But what if I told you it's actually a highly measurable, biologically active determinant of exactly how long you live? Let's dive right into it. Take a look at this quote. Emotional states are not merely a reflection of good or bad health, but are active determinants of longevity. Now, that isn't pulled from some self-help blog. That is the consensus emerging directly from longitudinal epidemiological research. It completely shatters the old assumption that happiness is just some fuzzy, abstract feeling. Instead, it sets a rigorous standard of hard, measurable evidence that we're going to unpack in today's medical dossier. Okay, moving right along to Section 1, Beyond Opinion, Medical Evidence. To really grasp the power of this concept, we have to look at the peer-reviewed science. Just look at the sheer weight of the scientific literature here. We've got massive meta-analyses from heavy hitters like Cheetah and Steptoe, Diner and Chan, and Steptoe and his colleagues. Notice those citation counts? Thousands of times. This brilliantly illustrates decades of empirical, longitudinal data. We are talking about the absolute gold standard of medical literature demonstrating that subjective well-being directly, unequivocally contributes to health and longevity. Which brings us to Section 2, the massive mortality dividend. What exactly is the scale of this effect? Well, prepare for an absolute avalanche of epidemiological data. The numbers we're dealing with here are just undeniable. Those meta-analyses we just talked about, they involved over 1.2 million participants. Over 1 million people. That proves the undeniably massive scale of this survival advantage. We aren't looking at small, isolated clinical trials of 50 people. We are looking at massive, population-level epidemiological data. And across that massive dataset, researchers found a pooled hazard ratio of 0.92. Now, in science speak, that represents a highly significant 8% reduction in your risk of all-cause mortality. Let that sink in. Just by possessing higher levels of subjective well-being, your overall mortality risk drops by nearly a tenth. And it gets even more specific. The most robust disease-specific associations are found in cardiovascular health. Positive emotional states are linked to a massive 20 to 25% reduction in mortality when it comes to cardiovascular issues. The data also clearly shows these benefits extend to protecting against infection and even improving recovery rates from chronic illnesses. Let's break this down a bit further, especially for community-dwelling older adults. Their mortality risk is roughly 15 to 25% lower for those with the highest positive emotional states. On the flip side, individuals in the lowest tertile, meaning the bottom third of emotional states, face a near twofold increased risk of mortality compared to the folks at the top. And here is the absolutely crucial point. These numbers remain entirely significant even after researchers control for baseline health, age, and socioeconomic factors. This proves once and for all that well-being isn't just a byproduct of being wealthy or already being physically fit. It's a primary driver of longevity in its own right. Section 3, comparable to quitting smoking. To really grasp the magnitude of what we're looking at, we need a benchmark. Think about this comparison for a second. The protective effect sizes of positive emotional states are literally comparable to traditional medical risk factors. We are talking about the exact same level of statistical benefit as smoking cessation or engaging in regular physical activity. This perfectly anchors the abstract concept of well-being to concrete medical reality. It is exactly that powerful. Let's get into Section 4, the biology of health capital. So how does this actually work inside the body? Let's transition from the epidemiology to the actual physiological mechanisms. First, we have to understand the enemy here, which is physiological weathering. This is defined as the gradual wear and tear on the body's systems and organs caused by chronic stress over a lifetime. It is a harsh clinical reality. Every single time you experience chronic stress, it physically weathers your biology. But positive emotional states fight back against that weathering, and they do it in a very specific biological sequence. Step 1. Positive states act as a direct buffer against chronic stress. Step 2. This maintains a remarkably lower baseline of systemic inflammation in your body. Step 3. It promotes a much more efficient autonomic nervous system recovery after a stressful event hits you. And Step 4. All of this preserves your health capital and significantly delays the onset of physical frailty as you age. It's basically total systemic protection. I really love this analogy from the research. Think of a positive disposition as compounded interest. Just like in finance, buffering against physiological weathering preserves your health capital over your entire life course. Over decades, that compounded interest pays out, and it manifests as a highly measurable extension of your human lifespan. Section 5. Hedonic versus eudaimonic well-being. Now, before we assume that just any good feeling does the trick, we need to look at two very different paths built into our daily lives. The medical literature draws a really sharp distinction here. On one side, we have hedonic well-being. This is focused on momentary pleasures, comfort, and avoiding pain. Think eating an amazing meal, going to a party, or a 5-hour couch bench. It's nice, sure, but it's very short-term. On the other side, we have eudaimonic well-being. This is all about meaning, long-term fulfillment, and purpose. It's the effort of mastering a difficult skill, volunteering in your community, or overcoming a serious challenge to achieve a goal. And why does that distinction matter so much? Because studies evaluating eudaimonic well-being showed a highly significant effect on building health, with a specific mortality risk ratio of 0.88. Building long-term purpose is deeply biologically protective in a way that just seeking momentary comfort absolutely is not. Finally, Section 6, building your physiological resilience. How do we apply all this data? Let's look at what specifically builds this resilience in the face of life's inevitable challenges. Here is a truly eye-opening reality. The science shows that having a high baseline of everyday happiness is actually less critical than your capacity for emotional recovery. The absolute critical marker is your ability to maintain positive emotions during stress. In fact, longitudinal findings show that a significant decrease in positive affect during stressful events actually increases your mortality hazard ratio. So the real secret here is emotional reactivity. It's not about forcing yourself to be happy all the time. It's about maintaining resilience and bouncing back when things get incredibly tough. And here's another fascinating nuance from the data. When we talk about positive emotional states, the ones characterized by high energy and arousal, like vigor, excitement, and staying active, are far more robust predictors of an extended lifespan than low arousal states, like simple relaxation. Energy and purpose literally fuel your longevity. Which brings us to our final thought. The epidemiological evidence we've covered today is overwhelming. The science is settled. Emotional well-being is a massive, biologically active driver of human longevity. So the question I want to leave you with is this. How will you build your eudaimonic well-being today? What challenge will you take on? Or what purpose will you pursue to build your own health capital? Thanks for joining me for this explainer, and I hope this data empowers you to live a longer, healthier life.